first platform we will discuss is the Medican platform. The Medican platform is an AI that has read and learned all the specialized textbooks and participated in the USMLE exam, where it managed to answer 98.1% of the questions correctly. And because of that, it can serve as an online assistant for you. It can help you in two parts. One is a medical chatbot, which means it can answer your questions instantly, and the other is differential diagnosis, which means you can enter your patient's symptoms here. Based on the references it digs up, it will check them, and then, to you, it provides a differential diagnosis for each of the etiologies it presents, along with a diagnostic test, and also suggests treatments. It asks follow-up questions. A chatbot on the right answers those questions. In the first slide, we entered a heart and soul case. It performs a differential diagnosis for each, acting as an assistant. We asked the AI chatbot for examples of drug side effects from those medications for the heart condition. Currently, it provides credible sources like the Hadithon book, CC book, UpToDate, and drugs.com. That's our current status. Ask questions anytime for complete answers. For example, it explains medications for autoimmune diseases, providing brief and detailed information. Look for examples of drug side effects that arise for the patient in order to take those drugs. For heart disease, if you have a question at any moment, you can ask it there, and it will provide a complete answer to your question. For example, we asked it to explain the medications used for autoimmune diseases. And first, it gives a brief explanation. If you want more details, it will also provide you with more comprehensive information. There are three other platforms: MedGPT, OBI, and MediSearch. MediSearch, OBI focus on recommendations, MedGPT on consultations. The platform is built on three pillars: data, algorithms, computational power. AI uses these to provide answers. Better data improves algorithm performance. This AI uses these sets and provides you with these answers. The better the quality of your data, the better the algorithms and mathematical equations that have been pre-prepared will perform on this. But what has made it possible for AI to exist is the hardware, specifically the GPUs. So it's the same situation here. Before the arrival of artificial intelligence, you had data that either had a very large volume, but few variables, or had many variables with a small volume, which could maintain the speed you wanted. But with the emergence of artificial intelligence and components like GPUs, you can now have both a large volume and many variables. When specializing in artificial intelligence, it's crucial to know your area. As data scientists, our role is to produce quality data, create models, and apply them, such as in medical applications. Domain knowledge is vital for data scientists. We must identify field gaps and how AI can assist. In chemistry, AI improved drug discovery tools by addressing flaws, offering a better platform. Focus in your field ensures you know your path in AI. It's crucial for data scientists to have domain knowledge. We must understand field gaps and how AI can assist. In chemistry, AI improved drug discovery tools by addressing flaws, offering a better platform. Focus in your field is essential to navigate AI's vast realm of equations and structures. Without clear goals, you might get lost. This domain knowledge in chemistry, we had 4 tools for drug discovery, and each had some flaws. AI addressed these issues, providing a better platform. It's important to focus in your field, so when you enter AI, you know what you're doing. AI is a vast realm of math and engineering, and if you don't know what you want, you might get lost. In AI, we aim to replicate the brain structure on a computer. Initially, a neuron was engineered on the computer. Dendrites bring in information, and calculations are done in the cell body, the activation function. The neuron decides to activate the axon. Multiple neurons form brain-like structures for analysis. These are neural networks used in deep learning. Neural networks like RNNs for speech and CNNs for vision are used in medicine. AI innovates with autoencoders and other encoders. Based on the function, our neuron decides to activate the axon. When you put many neurons, you form something like brain, which do analysis. These are networks, and deep learning operates on networks. We have networks used in medicine, RNNs based on speech, and CNNs based on vision. AI is creating new data, including encoders. We have GNNs and RL, 2 topics. If you're keen, you can explore these. The first we will examine is the RNN. So we have neural networks used in medicine. Recurrent neural networks are based on human speech, while convolutional neural networks are specialized based on human vision. Graph neural networks and reinforcement learning are two extensive topics. Now first is the recurrent neural network. For instance, saying he or she is a professor. All parts are interconnected and ordered. We need memory to learn these sentences, and its uses. We have graph neural networks and reinforcement learning, two extensive topics. If you're interested, you can dive into these areas. It can read health records and make personalized predictions for each patient, or create a medical chat platform like MedGPT to assist in clinical decision support and natural language processing. It can read electronic health records and make personalized patient predictions, or we can create a MedGPT-like medical chat platform that can read specialized texts and aid in clinical decision support and NLP. In drug discovery, introduce molecular structures to AI as sentences. The last topic is omics. The best known is proteomics, introduced by Google with AlphaFold. It provided previously unavailable protein structures. For specialized fields, is omics available? In drug discovery, we can also introduce our molecular structure to the AI system as a sentence. It provided you with protein structures that you didn't have before. But if you want to work in specialized fields, is there omics available or not? Well, if you want to take the data you have, for example, the electronic health records you have in your database, and apply a specialized algorithm to them, these are typical examples of what has been done. For instance, they first trained on electronic health records. After it learned, in the second step, it was asked to make a specific suggestion for each patient. For example, it was asked whether patient number 1 would have an intentional self-harm incident before the next visit. For the first patient, it said that it's very likely they will, while for the second patient, it said it's very unlikely, based on the history in the patient's electronic health record. The platforms introduced so far have been trained on medical texts. To train on global texts, use algorithms like GPT and BERT. GPT uses its architecture, while BERT is for natural language processing. Over the past years, as parameters increased, GPT's performance improved, with GPT 3.5 being a notable advancement. For deeper exploration, two main platforms exist. The Medical Open Network for AI at the University of Pennsylvania, focusing on medical imaging with ready-made codes, and Videogla, offering codes in biopharma, medical imaging, medical devices, and genomics. We're looking at convolutional neural networks to give computers the ability to see. It uses two main operators, the convolutional and pooling layers. We apply these operators to medical images. It has two operators, the convolutional layer and the pooling layer. These are architectures. It learns key features. We showed the AI various animal images, then an unknown one to identify. It has a 70% accuracy, providing probabilistic insights on the condition. For example, a brain scan previously trained on, showing healthy and diseased images. We provide images of healthy tissues and tissues with various diseases for AI training. Then, we give it an unknown image. And with the same methods, it tells us this unknown image has a 70% chance of showing pneumonia. AI assists by providing insights on the patient's condition. A trained brain scan shows healthy and diseased states. Analyzing an unknown image, it might indicate a 90% tumor probability. For deeper insights, specialized articles exist. Request a Rescape demo online and a premium account if suitable. GPT analysis details X-ray images. With a premium account, import medical images for analysis. Each of these software or platforms you use, for instance NVIDIA Clara, has a tutorial that explains everything in detail. Right now, Medical Chat performs differential diagnosis. Initially, it provides an explanation on how to interpret the symptoms.